Gentle exfoliation can be another important step to improve the appearance of melasma. This video is about what mandelic acid is and how it can be that step. I'm also going to talk about how I'm incorporating mandelic acid into my nighttime skincare routine, along with a few tips. Please keep watching. Hi, I'm Amy. Thank you for choosing to watch this video. If you are new to Invest in Your Face, I am a registered nurse. I have melasma, and this channel is dedicated to topics related to melasma. If you are looking for ways to help manage your melasma and you are not currently subscribed, I would greatly appreciate it if you would subscribe. And if you like this video, please give it a thumbs up. It really helps my channel. Now, mandelic acid is an alpha hydroxy acid chemical exfoliant. And I want to start by saying using an exfoliant is not necessary. Skin naturally exfoliates without an exfoliant. Also, simply cleansing can provide some gentle exfoliation. And you may be using products in your skincare routine already that help a bit to gently exfoliate. And when an alpha hydroxy acid is used, there are some products you would not want to use together because it could increase the risk of unwanted irritation and excessive dryness and possible over exfoliation. And I'll talk more about what some of those products are later in the video. Now, everyone's skin reacts differently to products, but when it comes to melasma, with skin irritation being a trigger, over exfoliating is of course something you want to avoid. And it can occur when an acid is used at too high of a percentage or too frequently. In other words, more than what your skin is able to tolerate. Now, exfoliating can make your skin initially and sometimes immediately look brighter and feel smoother, but over exfoliating with too much of an aggressive approach can creep up on you and cause an increase in inflammation, which over time leads to more melanin production and could make your melasma appear worse. So having said all this, why is it a good option? Well, mandelic acid is naturally derived from bitter almonds. It works like all alpha hydroxy acids by exfoliating the skin, loosening the bonds that hold the dead skin cells on the surface of the skin and allowing them to shed more effectively. Now, what is appealing about mandelic acid is that its larger molecules penetrate the skin more slowly and more evenly than the smaller molecules of other alpha hydroxy acids. It is twice the size of glycolic acid and a third larger in size than lactic acid. This means it is more gentle and less likely to cause skin irritation and can be used by all skin types. Exfoliants can help increase cell renewal without disrupting healthy skin cells, which is helpful because as we age, it can take additional days for the skin's natural cell turnover cycle. By increasing the rate of shedding these superficial pigmented skin cells, this helps to reveal the healthy skin cells and also improve the penetration of skincare products, which can potentially boost the effectiveness of the products you apply as part of your skincare routine that interrupt melanin production and target the pigment of melasma. And all alpha hydroxy acids have been shown to suppress melanin production. But like most skincare products beneficial for managing melasma, the key is gentleness, which is where mandelic acid comes in. Now, compared with other alpha hydroxy acids, it is the most gentle and most appropriate for sensitive skin. I consider my skin sensitive, or maybe a better word is reactive, because of my melasma. Regardless of being oily, dry, normal combination, the triggers for melasma make skin sensitive. In other words, most people with melasma cannot tolerate or bounce back from episodes of irritation unscathed, as well as someone who does not have a skin condition that is triggered by irritation, like melasma. Or rosacea is another one. Until recently, I had not been using an alpha hydroxy acid to exfoliate, specifically because I did not want to risk the potential side effects of dry and flaky skin, peeling, irritation, and then possibly making my melasma appear worse. Now, I think we can all relate to feeling sometimes more hesitant about trying a new product or treatment because the thought of any risk of making our melasma worse overrides the thought of the chance of an improvement. Am I right? But the more I thought about mandelic acid and I learned about mandelic acid, the more I realized this is a great gentle approach for someone with melasma to achieve all the potential benefits of an alpha hydroxy acid. Mandelic acid is not only beneficial for pigmentation issues, but also acne because it's an antibacterial. It also has many benefits for mature skin, such as reducing the appearance of fine lines and surface wrinkles. So what I was looking for with starting was to stick with one with a low percentage, look at formulation, and go slow with frequency of use. And going with this conservative approach may not apply if your skin can tolerate and you are used to using a stronger alpha hydroxy acid or using one more frequently than I'm going to be talking about, and that is totally cool. Regardless of melasma, everyone's skin has the potential to react differently, as I mentioned, but I think we can overall agree that gentleness is good, irritation is bad for our stubborn, frustrating to treat melasma. And it's commonly recommended that the best approach with any alpha hydroxy acid is to start low with percentage and go slow with frequency. And for me personally, I not only started but also maintained that low and slow approach. You can find mandelic acid in different products from cleansers and toners to serums and at-home peels. Best to stick with one form of mandelic acid, and the percentages can vary from as low as 3% up to 15% and more, up to 40% with some at-home peels. And I caution about at-home peels for melasma. Now, if you are interested in finding out if a professional chemical peel of any kind is right for your melasma, definitely consult with a dermatology provider or experienced esthetician. And comment below, anyone who has had a chemical peel to treat your melasma, please share about it. Now, alpha hydroxy acids can be used morning or night. I prefer to work it into my nighttime routine. My morning routine is consistent each week, whereas my nighttime routine varies a bit on how I work in a retinoid. Now, the mandelic acid that has worked really well for me is this one by Wishtrend, a Korean brand, and this is mandelic acid 5% skin prep water. This is a gentle, low irritant exfoliating toner that also includes panthenol, which helps to maintain moisture, Centella asiatica extract, which has been shown to calm inflammation, and it has also been shown in some studies to help prevent UV-induced hyperpigmentation. This also includes beta-glucan, which is a humectant, and it also includes a form of licorice root extract that has been shown in studies to have skin depigmenting properties. Now, Wishtrend describes this product as a gentle daily exfoliator. Their recommended use for oily skin is 5 to 7 times a week. Normal to dry skin is 3 to 5 times a week, and sensitive skin is 2 to 3 times a week. And as I mentioned before, I consider melasma in general to be categorized as sensitive skin, just by nature of how it reacts to irritation and inflammation. And my approach is 1 time a week. And that's just me. Again, everyone's skin can handle products differently. You need to keep in mind your skin type and tolerance and what other products you're using. And always patch test any new product. Let me know your thoughts in the comment section below and what your experience has been with alpha hydroxy acids. I love this product and recommend it highly. Mandelic Monday is how I remember what evening to use it. And I like the mild strength at 5%. So after I double cleanse, I put a few drops into my hand, and then I gently pat it onto dry skin, avoiding the eye area. Now I let it settle into my skin and give it some time to penetrate. And when I first started using this product, I would just follow it up with a good moisturizer, and that was it, my Monday nighttime routine. And a couple of days after my first application, I did notice a very slight pinkish color on the tops of my cheeks, very mild, no burning or irritation, and it resolved quickly. So after a couple more weekly applications, my skin was not having any issues, and I was able to continue with my usual skincare routine following the mandelic acid step. And I will post a video soon about my nighttime routine, including the retinoid. But in this video, I just wanted to talk about this mandelic acid. Now, if you choose to layer other products on when you use an exfoliant, then a loose guide would be cleanser, the exfoliant, then toner if you use one, any treatments or serums, and moisturizer. And to avoid the risk of irritation, excessive dryness, and over exfoliation like we talked about, or I talked about, do not use on the same day or night with vitamin A or retinoids, including retinol, retinaldehyde, or retinoic acid, unless otherwise recommended, of course, by your dermatology provider. Now, other products to avoid using on the same time as an alpha hydroxy acid are other alpha hydroxy acids, beta hydroxy acids, benzoyl peroxide, and vitamin C. And also, due to how pH levels are affected when used together, I skip niacinamide products on Mondays. Niacinamide can raise the pH of the acid and decrease the effectiveness, while acid can lower the pH of niacinamide and cause sometimes some redness. So take a look at the ingredients of your skincare products, especially your multifunctional skincare products, and always sunscreen during the day, regardless of your skincare routine, day or night. Sunscreen is a given. It is the best preventative and treatment step for your melasma. Keep in mind, like most, if not all skincare products that target pigment or are used for brightening, it takes patience, regular use, and time. At least 3 months of continued use unless something is causing irritation. Of course, you then want to discontinue. Another exception is hydroquinone. Best to follow the prescribing provider's recommendation for the length of treatment. And the results you get from mandelic acid are cumulative in that the longer you use it, the better results you will likely see. Prolonged use is safe. And I will say, I noticed an improvement of my skin texture after just a couple of weeks. And even if the appearance of the melasma is not immediate, just the texture improving is an improvement for melasma, in my opinion, because when the texture is improved, that makeup to cover it up goes on so much better. And when considering your results, keep in mind managing melasma is multifaceted, right? To include not only skincare products, treatments, but also sun avoidance measures, lifestyle changes, and of course, sunscreen. Well, I hope this information has been informative and has given you some tips to better manage your melasma. As always, never underestimate the value of having your melasma evaluated and a treatment routine recommended by a board-certified dermatologist. I want to say a quick thank you to my subscribers for your continued support of my channel. Please feel free to share this video with anyone who may benefit. Wishing you all good health, and thank you for taking the time to invest in your face. Bye.